Hi, my name is Amy Perry, and my presentation is on sexual assault in older adults. Just some stats to start with. 18% of women raped each year are 60 years of age or older. About 70.7% of older victims were assaulted in a nursing home. 14.6% of older victims were assaulted in the home of the perpetrator. 12.2% were sexually assaulted in their home. 2.4% were assaulted in an adult care residence. In 1/3 of the cases, sexually abusive acts towards elders were witnessed by others. In 90% of all elder abuse cases, the perpetrator was a family member. 2/3 of the offenders were adult children or spouses. It is important for us as social workers to consider trauma-informed care. As we have learned in this class, trauma is insidious and preys on vulnerable populations, making older adults at risk for violent victimization. Trauma exposure increases the risk for other vulnerabilities, such as physical health problems, suicide, mental health problems, etc. And these are a lot of the issues that are coming up in the medical care setting for older individuals. Trauma can be especially deep and life-shaping when people face repeated and prolonged abuse, and especially when violence is perpetrated by caretakers. So this is something that we as social workers and people within the medical profession really need to be knowledgeable about and consider when they're treating their older patients. As far as social justice goes, this is an issue that involves the individual, their families, and the culture in nursing homes, and other adult care facilities. It affects the community and it affects the wider society. According to one study, more than half of nursing home residents who were victims of sexual assault died within 1 year of their victimization. And older adults often face discrimination, but they have a right to fairness and equality just as all of us do. So as far as the circles of sexuality go, sexuality is a taboo topic, and it is especially taboo when considering older adults. They face a lot of discrimination, and a lot of times people do not want to hear or talk about these issues, but they're really important. It affects the circle of reproduction and sexual health because older adults are still susceptible to STDs, and those STDs can cause other physical health problems. And it also affects, of course, the circle of sexualization because within that circle we talk about sexual harassment and rape. So that is the issue. So I am presenting you with this today so that we can potentially make a difference in our careers and keep this issue in mind when dealing with our older adult clients. Thank you.